We're live. Good morning, everyone. It's an amazing spring day today. It's just the start of an awesome spring. I was just thinking this morning how different last year's beginning of spring was. We have been through an amazing year, an incredibly challenging year. We were faced with so many different challenges, and yet we only got stronger. We came together as a team, and I'm just really proud of this organization. So we're going to jump into an agenda here today. It should be a pretty good agenda here. I'll show it on the screen here. We're gonna do a little bit of a celebration. There's a couple topics on that we want to celebrate. We'll get into our updates on COVID-19, what's going on in the metro, where we are with our updated precautions. There's an email that went out last week, but I want to go through those a little bit. How we're doing operationally with volumes in all of our different departments. And then we're going to do an update with Dr. Z and John on how we're really taking care of our patients in a multidisciplinary way. Some really great improvements and outcomes for our patients, just based off of how we're partnering within the organization to focus on ultimately the patient. And then, frankly, just a quick reminder, we have talked many times about how we need to look out for one another. These are very challenging times, different times. And so we have to make sure that we're looking out for one another. Just a quick reminder on that before we sign off. So that's going to be our agenda. We have John, we have Peg. They're going to jump into the COVID-19, and then Dr. Z will be joining us a little bit later. So let's go ahead, and I'm going to actually do this a little bit out of order. I'm going to start with where we are with COVID in the community. You can see the current status. I'll bring in John and Peg. Morning, John.
Morning.
Peg. So lots of cases, 208,000 cases in Nebraska. Unfortunately, 2,200 deaths in Nebraska. The really great news, I think, is the recent trends. You can see in here that we're at about 81% occupancy. That's what we've been focused on from the very beginning. That's what we've been communicating. That's where when that number started to really change and the occupancy got stretched and bed availability and staffing availability got stretched, that's when we had to really think about how we needed to adjust as OrthoNebraska. But right now, the community is sitting in a great place as it relates to both occupancy and then total inpatients with COVID. Actually, I just looked at some numbers. The Omaha Metro this morning had 59 inpatients, which is incredibly low, and I think we need to be very thankful. Again, vents probably not the key resource issue going forward. I think how we're treating COVID has changed quite a bit. But the great news, really, on top of this, is a dramatic slowdown in the hospitalizations. Even though cases have kind of leveled off in the community, the number of hospitalizations and the number of deaths as a result of COVID have really dropped off. And it's because of this last item on the dashboard here, which is vaccination. So, Peg, I might just kick it over to you real quick, and maybe you can give your thoughts on where we are with vaccination, where we're going, and maybe even some thoughts on efficacy.
Sure. Thanks, Levi. Good morning, everyone. Yes, all good news on the COVID front this morning. In-house, we have about 82% of our staff have been vaccinated. And if you look back at where we were as far as staff being quarantined or isolated, last November, we had 43 employees out on a specific day because of quarantine or isolation. And as of today, we have none. So we are getting there. We are getting there. Now, the J&J vaccination series, as you all know, is a single dose and has seemed to have come on quite rapidly now and is considered very safe as well, with very few issues with it. They've been able to document that it is decreases mortality and morbidity tremendously, so it is a safe vaccine. and highly recommended by all the experts. One of the things we have to keep in the back of our mind is that the variants are still growing, and we're starting to see more and more variants in Nebraska, primarily because we've upped our testing of capability of doing that. So the concern there is the more people who aren't vaccinated, the more transmission is going to occur, and when you transmit, you mutate. So to get as many people vaccinated as fast as possible is key to ending this nightmare. Also, one key point that a lot of people keep asking me about is when can we get rid of these masks? And we don't know yet. We really honestly don't know. We have studies have started to be implemented to look at transmission from those who are vaccinated. So the concern is, if you remember that even if you're vaccinated, you might not get sick from it, but you could be exposed to it and become colonized with it, carry it in your nose and throat, not be sick, but can transmit it. And so the more people we get vaccinated, the less risk of us being exposed and the less likely that we will transmit it. Studies are going on right now to find out how transmissible we are once we're vaccinated. So if the studies do come back and note that there is a good decrease in transmissibility, then masks will slowly disappear. But right now, it's important to still wear those masks when you're out in the public and when you're out and amongst people who haven't been vaccinated.
And Peg, I think it's important to try to balance some of all of this. So I might say some things that make no sense. I'm far from the expert, but I'm just trying to be, a community member, but also then a healthcare, I guess, professional, not necessarily a provider, but a professional. From we have always thought about the flu shot and our responsibility as healthcare professionals to try to slow that spread, develop that herd immunity. So multiple things, so it doesn't get passed along, and so we take care of our patients, and we can continue to come to work and enable a workforce that takes care of its patients. So I think that's still consistent with the vaccine.
Yes.
And so that's why we have the precautions. That's why we think vaccines make a lot of sense. But that's from an efficacy perspective. On the other side, from just a community member, the vaccine. What I think is really important to remember is all of these vaccines that have been made it through for emergency use, they're all 100% effective from my understanding.
Correct.
Severe or
Death.
greater than severe death, they're all effective in that. So
Correct.
Maybe you can still catch it and you can still pass it along. We still need to mitigate that, but the effectiveness from severe illness is incredible with all three of these vaccines, right? So I think we just have to make sure that we're balancing how we think about this as healthcare professionals and then just as community members.
Correct. And that's similar to any virus. If you think about looking back at influenza or even colds, once you get that virus, then your chances of potentially getting it again is still there. But if you do get sick from it, you've got that inert immunity now that's going to protect you from getting seriously ill. Yeah. So this virus is no different than any other virus from that perspective. Good point, Levi.
John, we did it, so masks, that's still going to be something that we deal with as a community. However, we are thinking about some of our precautions slightly differently. You want to talk through just some of the important ones that we've revised within OrthoNebraska?
Yeah, so going back a little bit to vaccines, as we understand our numbers and then staying close to the new CDC guidance, there's been some changes that we've made related to quarantine. So those who've been vaccinated, it's pretty simple that you just continue to monitor. Peg had talked about some of the newer studies that are coming out showing low likelihood of those who are vaccinated spreading COVID. So that's where some of these guidance changes are coming from. So pretty simply, those who are vaccinated won't have to go through as vigorous of a quarantine or isolation period if they've had an exposure. So that's one change that we've made. But if you did have an exposure, we would still, even though you're monitoring for symptoms, we would recommend you wear a mask just to be extra cautious in that scenario. Another change we have made is we are starting to open up to allowing those from OrthoNebraska come back over to the cafe area. We want to proceed really cautiously as we start to loosen some of the precautions we've had in place. We don't want to swing the pendulum all the way back too far. So we also haven't had as many people. So just trying to understand what that looks like as we loosen things up. So we started that this week and it's gone really well. We still need to stay true to those basic precautions of social distancing and trying to limit those at tables and things like that. So we just ask you to be mindful as we're walking through. If you're walking through like the inpatient unit on the second floor, just be mindful of your noise and things like that, because that has definitely been a large shift as we've decreased the traffic through there as well. But people have done a really great job, I think, being mindful of the space. And then for those that aren't under OrthoNebraska, we still have a process for people to be able to order their food remotely. Masking specifically, so kind of going back to vaccines, when we are still able to socially distance, we are going to allow those like in a break room or in our meeting rooms. If you've been vaccinated, you can take your mask off, but we do have to still be able to maintain the social distancing there. Patient care areas will still remain all the same. They'll be masking at all times and we'll still follow all those procedures. And then, like I said, with meetings, we are going to start to allow some in-person meetings again now as we more people get in and bringing a few more people back on site for some of those more in-person interactions. So that's been kind of an exciting time for us to start bringing some small groups of people back together to actually physically see each other in person. So that's been an exciting thing this week as well. Visitor policy, we've continued to stay very close to this as well, with precautions, the risks, and also what others in the community are doing. We're going to make a small change. For the patients who stay overnight and have a dedicated room, we are going to allow one dedicated visitor for them during some limited visiting hours. So during the week, Monday through Friday, it'll be 7 a.m. to 7 p.m. And then on the weekends, it will be from 9 to 5. And that's aligning when we have access staff to help control that traffic at the door. So the ED will also allow one dedicated visitor to come in. All the patients or all the visitors will need to be screened just the same as we screen our patients. So still following that process at this point.
I think all good news, all smart stuff, things that I think a few things, John, right? I think this is consistent with what's going on in the community. I think it's consistent with what the CDC is putting out. But it's also trying to make sure that it's thoughtful for our types of patients and the experience we're trying to create for those patients. And we're going to continue to monitor and react quickly. As you know, I think the slide above, we said about 19.1% across the state have been vaccinated, at least with the first dose, right, Peg? 16 and above. You know, as that number continues to increase, we're going to continue to monitor these types of precautions and work our way back to the experience that we want. So, right, John? I mean, that's the goal, right?
Yeah, absolutely. That's spot on.
Yeah, and also, Levi, for those questioning how long we need to wear masks, if you think back to what we do for influenza, and over the years where we evolved, was that if we got 90% of our staff vaccinated, then those who weren't vaccinated didn't have to wear masks because we felt we were at good herd immunity. So we don't know what's going to happen with COVID, but most likely it'll be something similar to that, where those will need to wear masks who aren't vaccinated until we get to around the 90%.
Yeah. Anything else? I think our goal for this entire forum is to emphasize less around what we're doing related to COVID and more around what's going on within our organization. We'll continue to wean this topic, but anything else, John, Peg, that we want to tackle?
Just hang in there.
Yeah.
Awesome.
Ask questions. If you have questions, find somebody, and we're happy to talk through that with anybody.
Well, Peg, this is the last forum, right? When is your retirement day?
Next Thursday, April Fool's Day.
Oh, so it's a big joke. So you're gonna stick. You're gonna stick with.
Yeah, that was the joke.
If only. Well, Peg, we are just so thankful for everything you've done for organization, and actually, I just wanted to not just on behalf of the entire organization, but for me personally, this past year, from the very beginning of this employee forum, I said this past year has been quite the challenge. We've learned a lot, and I think we confronted that challenge, and not in a superficial way, but because of you, because of all of the work that you've put in, I'm not sure how we would have navigated this. I reflect on your guidance. I reflect on your positivity. I reflect on your anticipation. I just can't escape the fact that you early on said there is a possibility that by the end of the year there could be a vaccine, and that gave me so much more confidence in how we navigated this. And so your anticipation, your foresight, it's truly incredible, and I'm forever grateful. And that's just the recent impact that you've had on the organization, Peg, because of how you approach infection prevention, the way you partner, the way you guide, the way that you interact with the team, how tenacious you are around small little things that can create big things for our patients. Our infection rates I'll put them up against anybody in the world. We do an amazing job, and it's because of the culture around infection prevention that you've created. So I can't thank you enough. And just as a little going away present, we have something for you.
Peg, you finally made it after all these years. Thank all your expertise over the years for helping keep us safe and keep our staff safe, especially over this last year during COVID.
Congratulations on ending your weekends with 5 days. Hey, thank you for your guidance, for your encouragement. You've helped so many others to thrive.
You are the most incredible, amazing bug lady I have ever had the privilege to work with. I cannot thank you enough for all that you have done for this organization. Your leadership and your friendship and your smile is going to be greatly missed, and I wish you all the best in everything to come.
I am so grateful that I got to know you, and actually really kind of grateful for COVID because I got to know you even better, and appreciate everything you've done for this organization, and you will be severely missed.
I think back to the times we shared our office together and all the fun we had, plotting, disaster drills. We might have missed the mark on the pandemic one, safety rounds, joint commission surveys. Anyway, good for you. Have a happy, healthy retirement.
Have a great time hanging out with your plants and traveling, spending time with your family, and just good luck to you.
I just want to wish you the best in what sounds like a busy but fulfilling retirement. It has been an absolute pleasure working with you. You are so knowledgeable and warm. It's a rare combination to find.
Congratulations on a job well done. May your new journeys be wonderful and filled with enjoyment. We really appreciate all your work.
You are such a pillar of strength for me and my team, especially this last year. We always look to you for guidance and support and to comfort in any of your suggestions and your knowledge. I'm sorry your last year before retirement was so difficult, and let's just say it sucked. But at least it was memorable, just like you.
You've kept us safe for so many years, and it's just been a great joy to be able to work with you, and wish you well in your retirement. Have a great time and enjoy your grandkids.
We appreciate your guidance over the years on everything, even those little strange issues that we would have to come up with crazy solutions for.
After retirement, it's been a pleasure working with you. You can see we're keeping up with all of our policies back here.
Oh, Peg's leaving. Peg, we're We're really gonna miss you. Yeah. Hey, we're gonna miss you. Can you point all the things wrong with this picture?
Meg, I've loved working with you. In fact, I'm going to have this lotion with your name on it. Oh, there's no expiration date.
Hi, I'm Scott Minnesota. We'll miss you.
Good luck. Enjoy your
Thanks for your
retirement.
time.
Thanks for everything you do for us.
Yes.
Appreciate you.
You've taken care of us for years.
Bye, Peg. Come back and see us.
I cannot believe it's finally here. I want you just to enjoy the finish line, as Joanna says. You deserve it. Not many IPs get to say they get to retire in the middle of a pandemic, but you get to. And the joy and optimism you've given us over the last year and throughout your career at OrthoNebraska, you embody the OrthoNebraska way. I want to wish you happiness with your kids and grandkids, your hostas, and your husband. Much luck and much success, Peggy.
Oh, Peg, we're just going to miss you so much.
Peg, you there?
There's no way you can miss me as much as I'm going to miss you guys. Thanks. You're the best. I normally have a speech, but I don't have one right now. Just keep those damn hands clean and wear those masks.
Awesome. Thank you, Peg.
Thank you.
All righty. Well, with that, John, let's jump into what you and Dr. Z have been working on.
Yeah.
Maybe I'll let you introduce it while I bring up the slides here and bring in Dr. Z.
Yeah, so a couple of years ago, we took a deep dive into just looking at what we can do to better manage our patients, and just took this comprehensive view. There's Dr. Z. Welcome. And so we looked at a lot of different aspects that play into the outcomes that we have with our patients. And so after breaking all those down, we looked at what are those key touch points, what are those touch points provide with information, and how do we just better guide care. And to do this, we recognized that we were making a lot of decisions in silos in some aspects. And so what we did is really focus on increasing collaboration across all the different disciplines, including anesthesia, hospitalists, ortho, and partnering with all of our teams, nurse navigation, our pre-screening team, the nurses in the clinic. Just really everybody played a role in this. And it started out as a kind of a small conversation and grew to this larger project that we've been really successful in over probably about the last 2.5 years is when we kicked it off, and have continued to just look for opportunities. Dr. Z, I know you've been part of different parts of this, whether it's quality committee or peer review committee on a daily basis, helping drive the screening of patients and making sure we're getting good information to make sure they're safe for surgery. And I don't know if you want to talk a little bit about what that's looked like as we've increased that collaboration across the different disciplines.
Well, I think probably the biggest thing is that you've got these components. You talked about the silos, and I think sometimes within a setting like this, that's easy to have. I think kind of opening up those lines of communication, especially between, there was about 4 major components, and that was sort of the anesthesia and preoperative team. You had the pre-screeners here, which we've got an absolutely outstanding group of people that do. I mean, they work their butts off in terms of coordinating between the patients, the surgeons, the primary care physicians, specialists such as cardiologists and pulmonologists. The pre-screeners really kind of burn the candle on both ends in terms of sort of acting as the ones that are really running down and getting all of this information that we're using to make these decisions. You've then got the surgeons themselves, and then kind of one of the other components of that really that I think is really kind of that we've kind of pulled into the picture, and that's made a huge difference, is the hospitalist team, the Midwest Regional Healthcare team, and working with them as well when we do these patient evaluations prior to the surgeries. You've got those 4 components, and now you've got all 4 of those silos essentially opened up to where you've got the surgeons, the anesthesia care providers, and I include kind of the whole perioperative team with the pre-op nurses, et cetera, in that. You've got the hospitalists who are going to be potentially seeing these patients both before and then after surgery, especially if you have patients that are going to be spending the night. And then you've got the pre-screening team that's tracking down all of this information and kind of relaying the information to everybody else within those groups. And kind of the big goal here is to kind of reduce a few things. One, we want to reduce any last minute cancellations. We want to make sure that if a patient is in a position to have surgery here, we want to be able to take care of them as best we can and as safely as we can. And at the same time, we want to reduce the risk of canceling those patients and having them in a position where they have to go somewhere else for little reason other than just lack of information on our part. I think we've got a great group of people here, and there's a pretty wide range of patients that we can safely handle here at this facility. We just got to make sure we've kind of got our ducks in a row from an information standpoint. And I think that's where the multidisciplinary team care model comes into play, is making sure we've got that information. Everybody involved in the care of the patient has that information and can put that information to use in a timely fashion.
Yeah, I think with that planning, we now are better prepared when patients come in. On paper, some of them maybe look a little more complex, but we have some conversations up front and really work through what does that plan look like for this patient, or could it look like, and is it within our capabilities? And I feel like we've been able to safely care for a lot of patients that maybe historically we would have quickly turned away, but because we did our due diligence on the front end and then had a well-coordinated plan, we were able to provide a really great experience and outcome for some of these patients.
Well, and it is, and I think that's kind of the big bottom line, is being able to take care of the patients and have the patients have that experience. I think there's, I hate calling it a product, but you've got a healthcare product, and OrthoNebraska is in a position to deliver that. And it's a great product. I think there's no other place in the region that does the type and quality of orthopedic care here. And we want people to experience that. We want patients to be able to experience that, but you want them to be able to experience that in a safe environment and be able to take care of them as safely as we can. And I think we're in a position now, especially with that increased communication between the surgeons, the perioperative care team, the anesthesia, the pre-op nursing, post-op nursing, et cetera, the hospitalist team from Midwest Regional, and then those pre-screeners. I mean, all of those components working together. I think we're in a position now where there's really nobody else in town that's able to come close to what we're currently doing, both from a quality of care as well as a safety standpoint.
I couldn't agree more. I know you touched a little bit on the cancellation rate. Another big impact we've seen is the number of patients we've had to transfer out. And so with that heavy focus on the front end, we've been well prepared, and we've seen our transfer rate drop significantly over the last 2 years. So we focused some areas on cardiac and respiratory. We've been getting more people to specialists before surgery and making sure patients are more optimized before surgery. And that's really when we saw this large shift. And so again, there wasn't any one person or one group that made this possible. It takes everybody that, like you've talked about, Dr. Z, it took all those different groups working together to make this impact across the board. And as we've continued to do this too, I mean, we've had patients that we've run into some issues after surgery, but there's been great teamwork. We have the hospitalists and the anesthesiologists working together. We have inpatient staff and pre-post staff working together, is a lot of this typically does happen in the evening too, when sometimes we start to have a little bit more limited staff, but people have done an amazing job working together. And it hasn't been, well, this is your department, my department. It's truly everybody just coming together to take care of the patients. So it's been
and I think having that communication up front has been a huge help, because you see you're able to kind of anticipate a few of these things that do pop up. There's a number of complications that to a degree may or may not be preventable, but if we've got that information up front, we've had a chance to have all of those different groups, all those different members of the team be able to kind of do a little bit of pre-planning, a little bit of discussion before the patients get here. You can anticipate some of those complications, and you've got everybody on the team ready to deal with them and handle those potential complications in a safe manner.
Yeah, Dr. Z, I think that's what, from my perspective, when I look at these results and how we got to these types of results, what you just hit on is the big shift in order to generate it. It's anticipation, it's pre-planning, instead of reacting when these things happen, which is very, very important. If we pre-plan, then we have to react less. And so maybe my question then as a result is, where are you looking next? Where else can we improve? Where can we pre-plan and anticipate in order to create a safer and better experience for our patients? What are you guys thinking about?
Well, I think at least from the anesthesia standpoint, and this is something from a perioperative care team standpoint, when you look at the anesthesia care providers as well as the pre-op nurses, and especially working with the pre-screening team, is that we're increasing the coordination with the primary care doctors out in the community itself. Now, a lot of times the patients are seeing their own physicians. It's a non-OrthoNebraska, it's a non-Midwest Regional Health Service group of primary care docs that these patients are going to prior to coming to the hospital. And sometimes there's a little bit of a delay in terms of us getting that information. We've increased that outreach to the primary care docs, as well as a number of specialists in the area. And there's a number of things we touch on. Some of it's just things like some pre-op testing, things that need to be done prior to a patient coming to surgery. A big example would be, let's say, the patient with a cardiac history that occasionally you'll see a primary care doc or a cardiologist that'll look at the patient and say, well, you know what, at some point they're going to need a echocardiogram or a catheterization, but you know what, let's go ahead, we'll get this knee replaced first and then we'll get that done afterwards. There's an education component to that in terms of getting some of the primary care docs, the cardiologists, those other specialists who don't necessarily work as much in the operating world, I mean the surgical world, where they'll look at these patients and say, well, the primary concern for the patient is the fact that their knee really hurts. They want to get the knee replacement done. They want to get that surgery done. And so being able to educate them about the fact that, hey, there's kind of an appropriate level of pre-op care that has to be done before they have surgery, that's a big component of it. And that's something that I think we've kind of started working in that direction with a handful of primary care docs in the area, as well as a group of some subspecialty providers, the cardiologists, pulmonologists. Those are kind of the two big ones right now that we're working with. But it's increasing sort of an education in terms of what we as a facility, as a perioperative team, what we need from those community physicians to make sure we've got the patients maximized prior to them coming to us. Yeah. There's occasionally sort of I don't want to call it a cancelization, but occasionally you'll see sort of a pre-surgical delay, pre-surgical cancellation that happens days or even a week or two in advance because the patient didn't have maybe an appropriate workup, and we have to do a small delay on the patient's surgery. I think
that's a great point.
Is to get those mini cancellations, those slight delays. Let's get those taken care of farther in advance. That way it becomes a more seamless process prior to the patient ever coming here in the first place.
Yeah, that makes sense. I think, John, we did get very focused on those same day cancellations, and we have done a ton of work to reduce down those. And I think it's, how do we start to stretch out, the even further upstream cancellations? John, anything else to add on this work?
I think we just continue to look how to optimize patients on the front end. A couple of key things we've started to look at are, we've looked at hydration the day before, but maybe it's the week before that we need to really encourage patients to stay hydrated and make sure they're eating well leading up to the surgery. A lot of people get anxious, they're getting prepped, and they kind of forget to do some of the things we do on a daily basis. So just continuing to build on that education and what that pathway looks like for the patient leading up to surgery, and just having them prepared as much as possible.
Awesome. Well, Dr. Z, I would ask you about Husker football, but I don't know if I want the answer. And also, you look really funny in an office, so we'll let you get back to the OR. But thanks for spending the time.
Foreign territory for me.
Yeah. Awesome. Thank you.
Thanks, guys. Appreciate it.
All right. Bye-bye. All right, John, let's spend a little bit of time walking through our volumes, give some context to that, and then we'll get wrapped up here. So here's where we're at with some of our key departments and in volumes. The notes, I think the data is always something to pay attention to, but the context around any number, especially our volumes, is what's most critical. So we'll walk through these and then take a look at the notes, and we'll give some context. So the emergency department continues to struggle as it relates to total volumes. But if you see this note, what's going on nationally related to ED volumes is there's just a dramatic decrease. People are not engaging with the emergency department for care for a number of reasons. One, the world is slower, and so less activity going on, less need for that. Additionally, I think people are just trying to stay away from those environments for safety reasons. Unless you have to be in a clinical environment, you're going to try to avoid that. And I think that's what's going on. So nationally, significant reductions. We're feeling that here. The great thing about our emergency department is the access to care for patients should they need it, postoperatively, preoperatively, whatever the case may be. So our own patients having this access point. And then additionally, our experience really is extraordinary. The new group that we're working with is very focused, similar to us, around the experience. We take every comment very seriously on all of our surveys. We rectify those. The handoffs between the emergency department back into the clinic and the individual subspecialist has really improved. So this function, this department is performing well. Just nationally, the volumes are down quite a bit. John, anything to add as we transition here?
Just quickly with those ED volumes, what's been interesting, even with the lower overall volume, our orthopedic referrals have remained very stable all throughout COVID. And what's even more amazing to me, like you talked about, is that streamlined experiences. There's many of our patients that are able to be seen in the clinic within 72 hours of follow-up. So that's an amazing number. A lot of times that's a really frustrating thing after you've been seen in ER. So
and confusing, John, to our patients. So wait a minute, I showed up to an orthopedic emergency department. Why can't I get in to see an orthopedic surgeon right away? And so the fact that we've really cleaned up that handoff is just great news. Also great news is rheumatology. As most of you that really are paying attention to where we are from a volume perspective with our providers, we had two significant retirements. Dr. Weiss, Dr. Dowd, longtime rheumatologists in the community at OrthoNebraska. They retired, I think, a year and a half now ago. And so just finding the right providers, both at the physician level as well as the APP level, in order to take care of these patients. I think we're really starting to stabilize and see both volumes come back, but most importantly, our ability to take care of so many new patient requests. The demand for rheumatology continues to grow at a significant pace. And now we're finally able to say yes to patients that for a long time we just said, we don't have the space to take care of you in clinics. And so these volumes are really going in the trended direction that we're hoping to see. So jump ahead here into just great news. Physical therapy, record-breaking February, over 3,000 total outpatient visits. You can just see these trends. Again, just to orient to the graphs on the left-hand side. This pink side is the 2017 volumes, and then on the very right-hand side, that light blue is 2021. You can see at the end of 2020, the record-breaking volumes per month in September, or actually it starts back in July, then August, just a significant trend where we continue to create tons of access and again, an extraordinary experience. The way we think about physical therapy, it's an important part of what we are trying to commit to the community, which is part of their journey. The journey back to being able to do what they want to do. Physical therapy is a critical part, and it's also a great access point. The more patients that we can get into our physical therapy, the more that they are an OrthoNebraska patient, and then we can continue to take care of them in any one of our disciplines. So this is really important to who we are as an organization. It's part of the journey, but it's also part of our competitive strategy. Anything to add there, John, on physical therapy?
Nope, I think you got that one.
And I'm going to sound like a broken record here, but it's almost the exact same thing with imaging. We continue to reinvent how we create two things. One, capacity. Keep trying to refine the length of time that we can schedule into throughout the day, but also how long throughout the day that we schedule. We're now scheduling MRs into Saturdays, and our ability to get patients in the same day without jeopardizing open capacity, the refinement and the handoffs between the clinic, the clinical teams, and then the imaging team continues to be refined and enhanced. And that was the vision from, we'll call it 3-4 years ago, when we said the community sees us as one organization. They don't see us as Nebraska Orthopedic Hospital and OrthoWest. They see us as OrthoNebraska. When they walk into the clinic and they need an MRI, they expect a consistent, streamlined service, and we're really starting to deliver on that. And then the results kind of take care of themselves, as you can see on the paper. So, John, one more time, anything to add there?
I just 100% echo what you just said. I mean, just yesterday, I heard somebody that was struggling to get in to an MRI, a family member, and they redirected them here, and we were able to get them in very quickly for that, where they would have had to wait, another week or so to even get that process started. So I think it just speaks volumes to how we're able to create this great experience and streamline process for people.
So the clinic, there's a key adjustment you need to think through when you're looking at the clinic volumes. One, in January of 2021, we actually had 2 fewer business days, so 10% fewer business days. So that is some impact in what you're seeing in the clinic in January and February. The other two things are, we knew and we had to adjust over the course of January that we were going to have some providers out. Obviously, Dr. Singer, Dr. Hagen taking on this new challenge as investors and strategic partners within the hospital that they were founders of. That's going to have an impact on our volumes. We had some of our other physicians that were out, and so there was going to be an adjustment, but there's also a decrease in a number of days. And so what we do with this information, I think that's also part of what we need to communicate, is we're constantly looking at this to understand what's going on with patient selection. What is causing a patient to select us versus our competitors? What's going on in the market locally, and what's going on regionally or nationally? And we're part of what's called Ortho Forum, and it's large orthopedic groups. And so the management teams of those large practices share information. And what we're seeing nationally is just, in general, the orthopedic market is just it's a little bit lower than it was prior year. And I don't know if the psychology is, man, we're so close to having a vaccine. I'm just going to go ahead and we'll call it hunker down until I get that vaccine, and then I'll kind of resume a lot more normalcy. I'm not sure if that's what's going on, but nationally, orthopedic volumes are down. And so when you really think about our results around imaging, around rheumatology, around physical therapy, the adjusted number of business days, and really kind of 3 key providers out during the course of January, you adjust for all of that. And I am just really thrilled with what's going on with our volumes in the marketplace. I think we're competing incredibly well. And that's showing up in surgery. So the last item here is surgery. As I said, January, we had some adjustments that we needed to make based off of some physicians that were out, and Dr. Hagen and Singer taking on a new role, but a quick rebound, a solid rebound in February, our second busiest February we've ever had. And the way March is shaping up, the March 2021 will have, again, our second busiest March ever. So really pleased. And it's because of the work that you guys all do every single day. We talk about magic at OrthoNebraska often. That's what gets people to walk out of here and say, I had an amazing experience. And the second somebody asks for an orthopedic referral from one of their friends or family, we're top of mind. So the reason why we've done so well in this really challenging year is because of what you guys do every single day. So as always, let us know, managers, your directors, me personally, obviously John. Just if you have any questions on any of this, reach out. We'd love to answer. We also want to know your thoughts. What are you guys seeing in the marketplace? What are you hearing? We need to know those things. The more information we have, the better decisions that we can make as an organization. So, John, anything else to add on volumes?
No, I think you're just optimistic. I think as we learn through COVID, there's key elements such like as our MRI volume that really starts to project what we can see downstream with surgeries and other volumes. So that's promising as we see strong numbers there, and we just continue to hold the line.
Okay, 2 more quick items. One is just a reminder. I think this is very real. We've talked about this really when we close every single one of these employee forums. It's really important that we're looking out for one another. You don't know what people, your colleagues, your friends, your family, but what we're here to talk about is this critical team here at OrthoNebraska, your teammates, what they're walking around with, what is occupying their hearts and their minds. You don't know that, but there are resources out there, and I think being aware of these resources, identifying, your teammates that might be struggling with some issue, getting them steered toward these resources, it's really important. We know that people are struggling. We need to help. It's our obligation to help one another. And so the EAP, some telehealth services, Douglas County, those are all different avenues that and resources that people can use, have used, may need to use. And so keep these in mind, connect with one another, make sure that we're looking out. But just this is an important reminder because I think this is real. John, anything I'm missing or we should add here on this topic?
I just think it's important that we just look out for each other. I mean, I know there's these resources available, but I mean, really, if you're noticing something's off, I mean, just taking the time to just ask if somebody's okay. I think just that simple thing can go a long way. So just being there for each other, really important.
Thanks, John. All right, last item for today. We're running towards the end of time here. A reminder, we got to celebrate Peg earlier. She's just a really important part of our organization. And Dave Zuha, also really important part of the history of OrthoNebraska. Amazing attitude, amazing person. We get the opportunity to say goodbye to Dave Wednesday, April 14th. Come in, Dave will be there. Maybe he can tell us a few jokes, tell talk about how he likes to build buildings at Habitat and how he likes to run and share other stories from working with physicians for a really long time. Come in, say thank you, we call it farewell, but I think we'll just see you later. But I think just try to make an effort to come in and say thanks to Dave for all the work that he's done for OrthoNebraska. I sure will. I want to thank Dave a ton. Maybe there'll be a video later that we share. Dave will be in the office today, then less in the office as he continues to transition to his new role through most of April, but less and less time in the office here. So if you get a chance, please come by on the 14th. So, all right, John. Any words of wisdom before we sign off?
Just thank you to everybody as always, and hope everyone gets to go enjoy a little bit of the warmer weather this weekend.
Awesome. Thanks for everything you do, John. All right, everyone. I constantly am trying to think through what a great sign off should be. I still don't necessarily have one other than what John said, which is a huge thank you, not just from me, but from every single one of our physicians, our shareholders, on behalf of our patients. I know how many patients just rave about the care that they get here. Look out for one another. It's really important, and we'll see you soon. Thank you.